From Studio 3C in Rockefeller Center, this is News 4 New York.
As we begin to heat up, now's the time to get your sun regimen in order for the summer. According to the CDC, skin cancer is the most common cancer in the U.S. May is Skin Cancer Awareness Month. Dr. Cameron Rokhsar is a board-certified dermatologist and a skin cancer surgeon. Has some great tips now for preventing skin cancer and recognizing those signs. 1 in 5 people diagnosed with this now.
That's right. Skin cancer is the most common cancer, and the incidence of skin cancer has been increasing. There are different forms of skin cancer, and melanoma is the most dangerous skin cancer because melanoma can be deadly. And the incidence of melanoma has been increasing in the past 50 years by 690%.
And we're taking a look at some of these things. I think right now we're looking at a precancerous lesion. If you can, we're looking actually at the melanoma. This is melanoma. That's
melanoma. So as you can see, that looks just like a mole, except that it's irregular looking. If you look at it, it's not symmetric. If you cut an imaginary line in the middle, one half does not look like the other. The borders are irregular. It is larger than 6.6 centimeters. That's an eraser head. So it's got some unusual qualities to it. Okay. It's not a normal mole.
Now let's take a look at a precancerous lesion, something that you can spot right away. But what are some of the signs you should look for in this? And we see it on the screen.
So this is a precancerous lesion. So a precancerous lesion can look like a rough, scaly patch, for example. A lot of people think, oh, I just have dry skin. But you know what I tell patients is that if you have dry skin and you put moisturizers on and dry skin doesn't go away, that's not dry skin. That you need to see a dermatologist. The other important point being that if you have a pimple and the pimple doesn't go away after a month, that may not be a pimple. That could be a basal cell carcinoma because they can mimic pimples.
And let's look at a basal cell carcinoma. You mentioned that now. You're talking about things that you try to treat but don't go away, and here is that basal cell carcinoma. What are the hallmarks of this?
You know, it's very nondescript, really. When you look at it, it just looks like a little spot. You know,
sure.
It's a pimple. You know, sometimes skin cancers do bleed. Sometimes, you know, they don't heal. But the point is that if it looks like a pimple that doesn't go away, it should be checked.
And a squamous cell carcinoma, that's even tough to pronounce. I'm sure even tougher to spot. What are the hallmarks of that?
Squamous carcinomas also look like a scaly patch. They're larger. And actually, the precancerous lesions that you showed before, actinic keratosis, they can become squamous cell carcinomas. They're basically a rough, big scaly patch.
Now, so many people can brush off all of these signs so easily. I'm sure a lot of your patients have come to you and said, I don't think this is a big deal. We have some tips that we want to go through as to how people can prevent skin cancer and know when they should come see you. First off, seek shade, especially during the midday hours. Of course, it seems like a no-brainer, am I right?
That's right.
And wearing clothing to protect exposed skin, that's tough to do in the heat, doctor.
That's right, but you know, you can wear sunblock, and sunblock, you know, we recommend at least SPF 30, something with zinc or titanium in it. And the most common misconception about sunblock that people have is that they can just put a little bit on and it's going to last all day.
You have
but that's
to
just not true. You have to reapply every 2 hours, liberal amounts of it.
And wearing a hat with a wide brim, you don't see a lot of people doing that these days, but it can help.
That's right. It's important to really cover yourself up, you know, especially during the peak hours of 12 to 3.
And there are also going to be people that wear these sunglasses that wrap around. They're using the high sunscreen. Some people are going for the super high sunscreen. Is it worth doing an SPF 55 all the time?
You know, the common agreement is that as long as you use SPF 30 or above, that's good enough. I think the most important thing, like we discussed, is that you need to reapply that SPF 30 every 2 to 3 hours or every time you come out of the water.
And finally, we should point out that it doesn't always have to be the sunny 80-degree day that makes you susceptible to this. Am I right?
You can get ultraviolet radiation, whether it's shady or sunny. And as a matter of fact, the damaging results of UV radiation is cumulative. So it's important to protect yourself all day and all year long.
All right, words to live by. We'll be sun-wise. Thanks to you, Dr. Cameron Rokhsar.
Thank you.
For being here.
Don't forget to see your dermatologist once a year for your skin checks.
All right, all right. We'll book that appointment. Thank you. We'll be back for more News 4 at 7 after this.